from Community Hospice, and she is here to share with us all of the different services that hospice, and it's not just services, it's also kind of services and some guidance, right? So it's not just learning about the services that they can provide, but learning about getting the guidance you need to find the services that fit your community, that fit your family or your friend's situation. And it goes way beyond just like end-of-life stuff. So please welcome her with a good St. George welcome. Hazel's been working with hospice for well over 10 years now and has become a favorite when they need somebody to come and speak to groups like ours. So this is not her first rodeo. So I'm excited to have her with us. Thank you so much, Hazel.
Thank you. And on a Sunday.
Yes.
Thank you so much. And thank you all for having me. I retired from the corporate world. I was with CSX for many years, and then I ran an IT business for 12 years. And then I retired, and I was home and bored. And that's the truth. I was home, bored, and couldn't shop anymore. So I was looking for an opportunity that felt good, something where I felt like I was giving back and really helping the community. And I want you to know this job fell in my lap. I didn't go after it. It's just, I said, God, just put me somewhere so that I can be of good use and help people, and this is where I turned out. So I was with Community Hospice for 10 years, part-time, as the community relations rep for Duval County. I retired at the end of December 2022. Well, I thought I retired at the end of December 2022, and I was asked if I could please work PRN, so that's as needed. And when they need me to come and speak, because this is what I do, I go out and speak and educate the community, then they'll call on me. So I really am retired like 95% of the time, and then I come out and do this.
Me too.
Are you? 95% of the time. My glasses are fogging up, sorry. Got allergy stuff going on, and when I overheat, my glasses will definitely fog up. So I want to talk to you today about, I want to make it very informal because I want you to ask me questions if you don't understand, or if you just have questions, ask me questions. I can keep moving along. I'd rather you ask when you have the question, when you think about it, than to wait to the end, because then you may not remember it. And I don't want you to leave here without your questions answered. So stop me, okay? Because I'll get back on track. I never follow any guidelines. I use this just to make sure I cover everything, so you'll see me looking down from time to time, just making sure that I'm covering everything.
And there were a few copies of that. If you need a copy of it, let me know, and I'll make copies and get it to you. Okay? When it's all over, just let me know.
Yeah, copy of the presentation today, and you'll have 11 with this one. And then I have some other information I want to just tell you up front. At the back, there's a brochure that you can take with you. It's general information about hospice care, and then the numbers on the back for any questions you might have, or any services you or family or friend may need. You can call that one number, and they'll get you to the right department. So you'll get this. This is called an information visit card. Really important card, because if you know someone that may need our care, or you may need our care, you can give this information to that person, or you can call this number, and it's for a free information visit where a nurse comes out and just kind of do an evaluation. And if the person needs our care, or the nurse thinks they're ready for our care, then Community Hospice takes the ball and roll with it. They'll get in touch with the personal physician, and then they will see what's right for that person. Okay, information visit card, you'll get that in the back as well. I only brought a few books for anyone that's dealing with grief right now. I don't typically pass these out in the community unless there's someone that really needs it. And it's called Understanding Grief, Loss, and Bereavement. I think I gave you 5, so you'll have 6 with this one if anyone needs it. Okay, so we're going to move on and talk about community hospice and palliative care. So it's palliative care now because since for the last 10 years, we've provided palliative care, and I'll explain to you what that is in the community, but people didn't really know about it. People thought that all the services that were provided was just hospice care. But palliative care is long before anyone ever needs hospice care. Palliative Care Consultants is a company under the community hospice umbrella. They work as a separate entity. Palliative care is pain and symptom management for any illness. We have doctors and we have nurse practitioners that run that program. And what happens if the person's personal physician says, you know, you might benefit from palliative care, then they can recommend that person. That person can make the call and then get a consultation. It's pain and symptom management and coordination of care with your other doctors, making sure you're on the right track, making sure your medications are correct and you're getting the treatment or therapies that you need. Has nothing to do with hospice care. I wanted to say that first. It has nothing to do with hospice care. It's any illness, pain and symptom management, coordination of services and care with the primary care physician. Okay? So community hospice and palliative care. We're going to talk about the different programs of community hospice and palliative care and specialized services as well. So just a little information that I had somebody send me, because since COVID, I know everything has changed and our numbers were down as far as patients, employees, and volunteers. So I wanted to make sure I had the correct information to give you. Community hospice was established in 1979, and in 1986, which is so important, Medicare started covering hospice care, 100% of hospice care, and so does Florida Medicaid. But Medicare in 1986 began paying for hospice care. That's important because that's one of the main questions I get in the community. How is hospice care paid for? Medicare, Medicaid, and private insurances. We have 821, it might be 22, 23 by now, but when they pulled this for me last week, 821 employees. Prior to COVID, that was over 1,000. And every 2 weeks, there's a new class coming in, going through employee training, and most of that class are the healthcare, on the healthcare side, either nurses or CNAs, social workers. But twice a month, they have a new class coming in. There are 7, this I'm not certain about, but they have it in print, 754 plus volunteers. Prior to COVID, we had over 1,000 volunteers that helped throughout the 5 counties we serve prior to COVID. We serve 16 counties now, but there was over 1,000 volunteers, and those volunteers were so important to the job that we do in the community because, like what I do, health fairs and speaking in the public, I need help. So the volunteers that help me and the other reps in the community are called ambassadors. Those ambassadors will go out and speak on behalf of community hospice and host tables like at health fairs. I'm surprised that number is so high again, but they've been constantly trying to recruit volunteers. And if you want to volunteer, I have information for you. So that's just a little bit. We serve 16 counties now. We've gone into Palatka, Lake City area 2 years ago. 2.5 years ago, we actually expanded our territory from 5 counties to 16. So we're now servicing those areas. We have 10, I'm sorry, I need a water break. My mouth is so dry. Allergies, oak trees, and everything else. Florida, yes. So we have inpatient centers. A lot of people are confused about those places. You've probably visited someone there at one of the inpatient centers. The inpatient center serves, well, 2, maybe 3 reasons. Number one, it's the places, it's the facilities in the final days that people will go to in their final days. Most people want to be at home, but if they don't want to be at home, then they will go into one of the 10 inpatient centers that we have throughout our counties. The closest one here is Baptist Nassau. Yeah, I had to think about that for a minute. Yes, it's called the Jane and Bill Warner Center for Caring. It's an 8-bed unit, and it's Baptist Medical Center, Nassau. So that's the closest inpatient facility we have to your location right here. But we have 10 throughout Duval County, throughout Nassau, Clay County. We have, and St. Johns County, we have 10. So that inpatient center is used for those final days when people are transitioning. And if we are taking care of someone at home and just say their pain is not under control, then the nurse will have the patient taken to one of the inpatient centers to get them under control again, and then they go back where they want to be at home. 90% of our patients want to be at home and be taken care of at home. So we take everything to them, everything. The hospital beds, whatever is needed for the patient that we're caring for, we provide. We have our local pharmacy that's out in our headquarters on Sunbeam Road in Mandarin. We have our durable medical equipment company, so any equipment, beds, anything like that that's needed, the nurse orders it, and within 24 hours it's delivered to the home. And because we have all of our facilities here, we can get the services out fast. We are one of 5 hospice providers. We are a nonprofit organization. We provide service to anybody. It doesn't matter whether they have Medicare, Medicaid. If they don't have anything at all to pay for services, to pay for care, we still provide that care. Our foundation raises funds to fund underfunded and non-funded programs. So if you know somebody and they say, I can't afford it, I'm not on Medicare yet, I don't have Medicaid, I don't have private insurance, but I think I could use hospice care, they'll get that care. And that's important because for-profit organizations don't do that. We care for everybody. We don't turn anyone away. Okay? I see some faces that might want to ask me a question, but I hadn't seen any hands go up, so I'm going to keep going. How about that? So the inpatient centers are used for short-term care to get the person back in control if the pain is out of control, and for those final days when the person is transitioning. A lot of times our patients will be at home and say that's where they want to be with their loved ones when the time comes. And sometimes they change their mind because they don't want those memories there for their loved ones. What will we do? We'll come and get them and take them to an inpatient center. It's whatever they want. But yes, yes. Yes, she's asking, do I know if other states work or perform the way that hospice does here? The main guidelines for health, yes, because a lot of that's governed by Medicare. So yes, services, yes. As far as who receives services and additional services that are maybe on the side are programs like palliative care, that's not governed, so they don't have to offer that. But basic services are, yes, they're the same. You're welcome. Any other questions? We'll move on. I know you'll have, I see that hand. Uh-huh. You do. That's correct. So we will go in and take care of the patient. And it depends on the need at the time, whether the nurse is scheduled to go in twice a week to check them, or whether the CNA goes in 2 or 3 times a week, to bathe them and change the linen. But yes, they have to have. We don't provide 24/7 care. They do have to have a caregiver. Yes. We do not. We communicate. No, we don't have. We're not a service provider in that sense that would provide you with a caregiver. But there are other organizations out here that you can contact, like My brain just kind of shut down then. I'll tell you the name of a couple of organizations when it comes back. It'll come back. You do have a list? Okay. There's a list of organizations that can help, but we do not do that part. No, we do not. Okay, so we talked about the care centers in the various areas, and the service area now is 16 counties. I'm going to name those counties for you because you might have family or friends outside of this area that may need our care. We're in Northeast and North Central Florida. We're in Alachua, Baker, Bradford, Clay, Columbia, Dixie, Duval, Gilchrist. Am I going too fast? Hamilton, Lafayette, Levy, Nassau, Putnam, St. John's, Suwannee, and Union counties. Now, I cannot match up cities with those. I cannot match up cities with those counties, but those are the counties that we're serving. And up until, I think that document of need was 4 years ago, and they actually started hiring 3 years ago for the different new counties. Prior to that, from 1979, we served 5 counties, and that was Duval, Nassau, Clay, St. John's, and I'm missing one. Baker, thank you. Those were the 5 that we served for all those years until, like I said, about 3 years ago. So the services we provide, we talked a little bit about that is our nurses go into the home if that's where we're seeing the patient, but just remember, we go to wherever the patient calls home. Nursing home, assisted living facility, hospital, wherever the patient is and calls home, we will go and provide those services for them. One of the things I tell the community, wouldn't it be great that if your loved one was in a nursing home, that they had extra hands of care and extra eyes on them by having community hospice also come into that facility and take care of them? And that's what happens all the time. So just because they're in a nursing home, it doesn't mean we can't go in and that can't be one of our patients. We can. It's wherever the person calls home. So now you got 2 set of eyes on them, right? But we would be the primary for that patient that's in that nursing home. Primary meaning we're going to be the ones to check them out, make sure the medication is right, visit with them for whatever number of days that is required. But we can see them in nursing homes and visit with them and take care of them, in hospitals as well. We have certified nursing assistants that we talked about go out, and they don't clean the house, they don't cook, but what they do is take care of the patient. They will change the patient, bathe the patient, change the linen on the bed, and dress the patient, and make sure that the medication is lined up for them and everything is in order. That's what the CNAs do. The nurses, that's their patient. They're assigned to that patient. They're making sure that the patient is getting everything that they need, and if there's additional care or services needed, the orders come from the nurse. And the frequency of how often those professionals go into the home, and remember that's wherever they call home, depends on the need of the patient at the time. So if they're getting closer to the end and more time is required, then they will increase their schedule. But the nurse and social workers make that determination. We also have chaplains assigned that will go into the facilities if the patient and family want them to come in. We don't assume anything, so we will ask, and if they would like a chaplain to come in. I went out, actually, when I first started working for community hospice, I rode out with a lot of the professionals to see what they did, so that while I'm talking in the community, I can tell you firsthand what I've seen them do and what they really do. And I rode out with the chaplain to 3 different homes, and it was such a beautiful experience to see what he was doing for the families. And the last home we went to, the gentleman was the patient, and the chaplain asked, well, do you want to hear some music today? And the wife nodded her head, which I think the wife should have been a patient too, but at the time she wasn't, and the daughter was taking care of both of them. And he went to his car and he got a guitar. And I was like, you play music? And he sang beautifully. So he got his guitar and he started singing one of my favorite hymns, Amazing Grace. And I had to walk outside. It just was overwhelming to see how far they go for the patients and for the family. So it was a beautiful experience for me to see that. One of the things I want to mention, too, when I said our hospice patient, if a person becomes a hospice patient, we provide everything for them for the hospice-related illness. And that's important because if they are a patient of ours because of heart disease, we're going to make sure we provide whatever medication is needed for heart disease, but not for any other illness that's not related. That medication and those prescriptions would still come from the primary care physician. So anything that's needed that qualified that person for hospice care, we provide. I think that makes it a little simpler. We provide. Any questions there? I usually get questions there. No questions, sir? All right. Oh, yeah. That's okay. Okay, yes. I hadn't gotten to that part yet. But I'll get to that part right now. It's important. When you come into hospice care, at that point, typically the other doctors have said the traditional medicine to try to cure isn't working. So radiation and chemotherapy isn't working. When you come into hospice care, they're not going to give you those medications unless it's to keep pain down. That's the only reason. It's not to prolong life. If that doctor, the oncologist, says this is the only thing that's helping with pain, then yes, they will make the exception, and that nurse takes care of that and work with our doctors to make that determination that they need that radiation for pain and not curative. Did that answer? Okay. Yeah, but if it's for pain and the doctors make the determination they need that radiation or whatever for pain management, it will be given, but it will not be given for curative. Is that kind of clear? Okay. Mm-hmm.
You know, insulin for diabetes.
You're going to still take all of that.
Okay, good.
Mm-hmm.
That's what I was thinking.
It's just that curative medicine. If it's cancer, it's just, oh, let's stay down there. Then it doesn't have to fall again. But yeah, they still take their other medications. What I was saying a little earlier, just to make sure you're clear about it, is if that person has heart disease, that's what qualified that person for hospice care. So then we're going to provide whatever is needed for that hospice illness. Okay? But yes, they will still take whatever other medications. Yes. So we have grief and bereavement counseling available as well. A lot of the community doesn't know that. If you had a loved one to pass in our care, then you could get some one-on-one counseling for up to 13 months, you and the family, whomever needs it. If the community needs counseling and they didn't have anyone in our care, then they can join some of the group counseling sessions. So community, no one in our care can still get grief counseling, but it has to be in a group setting. If you had a loved one in our care, then the family can get one-on-one counseling for up to 13 months. So that's the difference. And the importance of the 13 months is to get people through birthdays, holidays, anniversaries, to get that family through all of that. So that's why I say up to 13 months. Clear? I see some faces, though, that don't look like they really understand what I'm saying. So, but are we okay? You understand that piece? Okay. So we do have, I told you about volunteers. A lot of our volunteers go in and sit with patients. That's a beautiful thing. You know, they'll give the caregiver a break. If the caregiver has a doctor's appointment, then the nurse or the social worker will make arrangements for a volunteer to come and sit for a few hours with the patient. They are trained. That the volunteers that sit with patients, they go through training to understand the needs of the patient and what they can and cannot do, because they cannot give medication. They can sit with the patient. So that's available as well. We have social workers that meet with the family and help the family as well with any paperwork for, just say the family needed to apply for Medicaid or whatever. Then that social worker is going to sit with the family and help that family get through all the paperwork and the red tape of other organizations that they may need help from. I think we have a wonderful team, though, because the team is so complete with the doctors, the nurses, the chaplains, the CNAs. We have a music therapist that from time to time she will go out and play music in the homes, in the nursing homes most of the time for groups. And she actually will come into the community for some of my old accounts, and if the reps want them to bring her into the community, she will come out and play music and sing. It's a beautiful thing. You may have seen some of our therapy dogs around the way. Our therapy dogs go visit with the patients, and the patients love them. And the interaction, I went into a patient's room when I first came on board again and was riding with a social worker, and we went up to the Morris Center that's on 8th Street, across from UF Health. That's one of our centers. And when we walked into the patient's room, she didn't even turn to look at us. She didn't acknowledge us at all. Right behind us, one of the volunteers came in with a therapy dog. She totally ignored us. And she sat up in her bed. She said, "Please put him in the bed with me." And they do so much. It's unconditional love, you know, from these animals, and they are so gentle. And so our patients react to them. Our patients love them. I've taken them in the community at different health events or health shows, and people just love them. But so our therapy dogs go visit with the patients, and will also go into the community if we need them to come out for different events. So that's the therapy dogs, and they are trained. Their owner is a community hospice volunteer, and that person has gone through volunteer services training. So they're all trained, the dog and the volunteer, the owner. Yes. We have a program for children called the Hospice Care program, and it actually goes up to age 21. Most of our Hospice Care patients right now, children, are palliative, not hospice. They're palliative. We do have a few that are in the hospice program, but most of the children in the Hospice Care program right now are in our palliative care, which is pain and symptom management. That program is not funded. So Community Hospice Foundation raises the funds to pay for the services for Hospice Care services in the community, and for the therapy dogs as well, because that's not funded. And so the foundation raises, they have about 5 major fundraisers every year. Remember the car show that used to be down here? Is it back? Okay. Community Hospice is a benefactor. And I know in the past that they received a check for $100,000 for each one of the shows. So that money is going into those programs that are non-funded. And remember, we turn nobody away. So when we have somebody come into our care that has no means of paying, that money can help also in that area. So that's what the foundation does. We have specialized care for veterans. The nurses and the social workers go through a little additional training to understand the different wars that our veterans have served in, because based on the information and based on the war they served in, they deal with different issues that affect their health. So the social workers and nurses want to be aware of that, so that if there are special needs of that veteran, they can make sure they're taking care of those special needs of the veterans. We had additional veterans programs that are coming back now that they have someone in place as a director of that program. But after COVID, it kind of sat still for a while. We do have a pinning ceremony for our veterans as well to show appreciation for them, where we will go out, present them with a certificate, and pin them and thank them for their service. If you've ever visited anyone in one of our inpatient units, have you ever seen a military flag outside of the door? That person in there is a veteran, and that's the branch of service they served in. They will put that flag outside the door, and when that person transitions, the family is presented with the flag and the pin. It's beautiful. We have a program for children twice a year called Camp Healing Powers, and it's for children who have had loss, and it's ages 7 to 17. It's a weekend with counselors and other children who have experienced loss. It's no charge to the family. It's $35 to reserve the spot for the child, but once the camp is over, they get the $35. Because most children don't know how to express grief, and most of them hold it in. So this camp is a way for them to feel free enough to discuss their feelings and to get counseling to help them through it. I think I told you about most of the services, but if I didn't, I'll come back and tell you. What was that? Oh, I'm sorry, I'm being a little noisy and messy. I'm sorry. I just want to make sure you totally understand that we have a lot of service available, and it's not just about hospice. And of course, we are a hospice provider. And if the person's medical doctor, a specialist, think it's time for hospice, if a family member think it's time for hospice, they can get that free information visit. It doesn't have, the free information visit request does not have to come from a medical professional. You could pick up the phone and call that number on that card and say, I'd like an information visit from my loved one. You're not committing to anything. What you're doing is a professional will come out and do an evaluation. And if they say, yeah, you know, you might be right, it might be time for us to come and help, it doesn't mean that we're saying that person is transitioning soon. It doesn't mean that we've given up hope. We don't give up hope on anyone. It just means that maybe it's time that that person and their caregiver gets some needed support. And so, yes, it may be time for hospice, but it doesn't mean we're walking in saying they're in their final days or hours. So many people don't call us until the final days. But it doesn't mean that. And it's important to know that we've had people in our care for up to 4 years in hospice care, not palliative. We've had people in our care, and let me explain that piece for you. As long as there is some decline in health, because you're recertified quarterly, Medicare requires that you're recertified quarterly if you're receiving hospice care. And as long as there's some decline, some people decline fast, some people decline slowly. Some diseases, you decline fast, some slowly. So as long as during that reevaluation it shows there's still decline, then Medicare, Medicaid, and private insurance is going to continue to pay. It's all driven by insurance. It's all driven by insurance. So that's the reason this person was in our care for up to 4 years. They were sick enough to come into the program. The doctors knew that they needed the type of specialized care, but their decline was slow. We've had people who got so much better they came out of the program. They were released from hospice. I witnessed that with the man with the heart disease. I think that's why I keep referencing heart disease. Is I went out with a nurse, man at the beach. He had heart disease, and that particular day she had to tell him, you have now graduated from our program. It was so funny because she said, you're walking 2 miles a day on the beach. You are doing well. You don't need our constant care anymore. He was like, oh, no, you're not going anywhere. He said, you all are not leaving me. And what she explained is, we're never leaving you. We're going to let you do you because you're doing well. And if you need us, or when that day comes, that there's decline, because it's going to happen for all of us. But when that day comes, we're back here with you. And the way she explained it, and she said, and we'll call and check up on you once a month, but you can't stay in our care right now because you're doing well. So I got to see someone discharged, and I can share that story in the community because I actually got to see it. People get better, and then they're discharged out of the program. So that's important to know. Eligibility. If a primary care physician or specialist says that they think this person has 12 months or less to live, Medicare's requirement is 6 months or less. That's just the prognosis, right? Because something has to go down on paper, but they don't know. It's not in their control. And we know that, but there has to be a prognosis. So that's 12 months or less from the person's doctor. But for Medicare to kick in and start paying for it, it has to be 6 months or less. And I just told you, we had somebody in our program, several people, up to 4 years. So it doesn't mean death is imminent. It means they had to have a qualification to get the service. And as long as they're declining at whatever speed, then Medicare, private insurances, and Medicaid will continue to pay for the care. Y'all shaking your head, but I know it's some doubt. Because that's real important. That piece is real important. Most people don't know that. But we're good on that? Understand that piece? Uh-huh.
So if a patient is in hospice Medicare and they have a heart problem, they need a blood thinner, do I hear you saying that hospice would not cover that, but you could still go to your own doctor? Would your private insurance with Medicare pay for those heart medicines?
They're going to still pay for everything they've been paying for. They don't decrease your care or your services because you're adding a service. They're going to continue to cover everything. So if that patient that you're speaking of was in our care for, did you say heart problems?
Could you get my microphone?
I'm sorry. I couldn't hear her, and that's why I stepped up. I'm sorry. Okay. I understand. Usually I talk louder. So if that person qualified for hospice care because they had a heart disease, then we're going to cover all of that. And when I say cover, we're going to take care of that person, and Medicare is going to pay for that. If they're on other medications for other problems, Medicare is going to continue to pay for that because they still have their primary care physician for those needs. Was that clear? I saw one more hand, though. Yes, sir.
About 20 years ago, my father was in a nursing home in Illinois. Well, my mother, too. And although I knew a lot about hospice, I never thought about his situation. And they called me once, and they wanted to started doing feeding tube. And I said no. I was very adamant about that. And then when I said no, then they called in hospice, and I never thought about that. I mean, do you sometimes get pushback from institutions that want to keep people alive so that, yeah, that's what I figured.
All the time.
Yeah.
Okay, I'm sorry. Help me, because I know you say. Okay, I got to get it clear. I heard what you said, but for me to restate it,
Over there.
I need to hear you right now.
My father was in a nursing home, and they called me and wanted to give a feeding tube.
I got it. I had to get back on track with what you were saying. Thank you. Because they wanted to, and you said no. And that they were right to call you. They got to call the next in line, wherever that person is. If they don't have somebody locally, then they're going to look to see who's next, and they call that person to make the decision. Okay, well, that was real important. But yes, so they call you to make the decision. And so when you said no, then they wanted someone to come in, like hospice, to take control of that patient and take care of them until the end. Because when you said no, I don't know how close that person was to transitioning.
He died a week later.
Yeah. So you needed an organization like hospice to take care of them, and that's why they did that, yes.
But I think that they could have done more for him had the nursing home called and said, let's get hospice in here to talk.
And that is so hard for us because a lot of doctors and a lot of facilities don't want to give up their patients.
That's what I thought.
It happens a lot. And that's unfortunate because that person could be getting the care they need and not the care that that facility assumes they need. Because remember, our doctors and nurses do the evaluations. But let me tell you what also could have prevented that. A living will. Does everybody have a living will? I'm not going to talk too much about it because I know you already have them. So if you have your living will, and if they had had a copy and accepted a copy from Florida because it's state by state, and they had a copy of it, they would have seen what the wishes were and would have had to abide by those wishes. But what happens is, if you had one from Florida and you were in another state, you'd have to make sure that that state will accept the one from Florida. And if they will not, then you fill out the one right away for that state. Because it asks those kind of questions why the patient can make their own decisions of what they want and what they don't want. And it's a legal document. In Florida, it doesn't have to be notarized. In some states, it does. In Florida, it just has to be signed and witnessed by two people to make it legal. But that would have taken care of that for you if your loved ones have a living will. So just think about that. You might have a living will, but you might have a loved one or a friend who does not have a living will. And that living will takes care of all of that guesswork. It takes the guesswork out of it. It takes that person from suffering through something they didn't want to go through anyway. So living wills are really important.
In addition to the medical assistance, would you talk about the supplies hospice provides to the caregivers?
So I talked about that we had our own durable medical equipment company earlier, and that's the company that has all the supplies, the lifts, if they need a bed lift, the bed, anything that is needed for the patient, we provide for our patients. Our durable medical equipment company will provide whatever that patient needs because we have a warehouse full of everything. Yes, we provide everything. The nurse and CNAs are going to make sure that they have the pads for the beds, the diapers, whatever. Just remember it this way. If that person is in community hospice and palliative care, we're going to provide everything they need. We're going to provide everything they need. It is tremendous. Have you all had family or friends where you've seen that and been a part of all of it? It's a beautiful thing, and to have our own local company so that it can get out to the patient and to the caregiver and family within 24 hours. What I was told is that if the order comes in by 10 a.m., there's a 90% chance that they'll get everything out to them that same day. That's beautiful. And medication as well, because we have our own pharmacy. Our main office is in Mandarin on Sunbeam Road. It's a part of one of our inpatient centers, the Hadlow Center. You may have heard of it. Yes. I saw your hand.
Will your durable goods company accept donations?
So, will your company accept donations? I did better that time, didn't I? We used to, and I'm going to tell you, it hurts for me to say this. We used to have 3 thrift stores, and so anything anybody wanted to donate went to the thrift store so that people could come in, and it was something affordable, like a chair may have been $25, or, what I'm saying? They closed them. After COVID, it was really tough. They closed every one of our thrift stores, that one on Beach Boulevard and wherever else there was one in Clay County. I don't know if you all had one down in Nassau, but they closed all of the thrift stores, and now they do not take donations of chairs and equipment. I wish they did, yeah. Does that answer that question? Is there something else pressing in your, I'm not going to do it, pressing in your mind that you want me to cover? I still have quite a bit to cover, but is there anything pressing?
Well, this is just kind of, might be off a little bit, but a few years ago, I understood there was either a volunteer that, for those who have transitioned and have a pet remaining.
I'll tell you about that. Okay. That's called the Pet Peace of Mind program. It's part of the Volunteer Services Department. When I was talking to you about the therapy dogs, they started a program 6 years ago called the Pet, it might be 7 years ago, Pet Peace of Mind, because so many times our patients have pets. And the caregiver doesn't have time for themselves, so you know they don't have time to care for the animals in the house. So our Pet Peace of Mind program, our volunteers will go in and take care of the pets. They'll feed them, they'll bathe them, they'll take them to the vet appointments, they'll make sure they have food. We provide the food. We'll provide the vet service. That money is raised by the foundation as well. And they have their own little fundraiser every year to raise money for that program. But so the volunteer will take food in, will bathe the animal, take them to a vet appointment that we pay for, and take care of them. So that's the Pet Peace of Mind program.
But then once they transition,
And so once they transition, if there's not a family member that wants the animal, we will take the animal in and get the animal adopted. Isn't that beautiful? There's a few cats, too, that came into the program. I think it's beautiful. Because, I mean, you know that the caregiver is stressed out and don't have time for themselves, caring for their loved one. So you know they're not going to have time for the pets. So that Pet Peace of Mind program does all of that for the pets. And then, like we said at the end, they will bring them in to a facility and get them adopted out. Yes, ma'am?
so many years ago, a friend of mine went through hospice, and he was, at that time, at the end of his life, they allowed his wife to bring in his two pets, his two dogs,
Mm-hmm.
to basically say goodbye to him. Is that still allowed?
24/7.
Okay.
The pets can go, there are no exceptions. When a person is in that stage, you want them as peaceful and comfortable as possible, and so many times those pets are the key. So the pets, the family, the friends can go in 24/7 to see that person. It is good to know. And I've been in some of our facilities where the pets were visiting, and I mean, it's everything to see that patient's face with their pets. Yeah, we do. Yes, ma'am?
I don't think I quite understand the palliative care.
Okay.
You say pain and symptom relief.
Uh-huh.
What is symptom relief?
So it depends on the individual and what they're dealing with. The palliative care program, and it is a paid program, insurances usually cover it. It's a paid program. It's not like hospice where Medicare covers 100%. So understand that piece first. There may be some costs associated with it, and Medicare, private insurance, and Medicaid. The social worker would find out if they will cover it, because it might be some private pay. I want you to know that up front. If you're under the care of another physician, it could be your primary or it can be a specialist. And they said, you know what, there's another group that can help make sure that you stay on track with your medication, with your physical therapy, with whatever else you're going through. Why don't we call community palliative consultants and let somebody come out and see you? And so that nurse practitioner or that physician's assistant, I think they have one doctor that is over the entire program, would go out and say, you know, we can help you because you're not taking your medication right or on time. We can help you. We get this lined up. We can check in with you. We can call you back. We can help you coordinate that care so that you're not missing out on your therapy, you're not missing out on your medication. We're going to keep track of you and help you get through that. Does that make sense? Pain and symptom management and coordination of services and care. They'll work with the primary physician to do that. Did that help a little bit? Okay. Any other questions? You got some that I didn't cover yet? So I talked to you about our different programs, grief and bereavement program, our pet therapy, pet peace of mind, our Hospice Care program. I have a program that we do in the community. I saw on your website that you have a caregivers group, support group. There's a wonderful presentation that I could come back out at some point and do for your caregivers. It talks about the caregiver more than anything taking care of themselves first. And many times you hear that caregivers pass on before the people they're caring for because they don't have time to take care of themselves, take their medication, go for their doctor's appointments, take a break, ask for help, ask for help, ask for help. So many of them don't. And believe it or not, with a lot of family and friends, if you don't ask for help, they don't offer. So that particular presentation gives a lot of pointers to caregivers. Okay. So that's something, I did see that you had that group. So that's something we offer. We offer a lot of other presentations in the community that can help as well. I need to send you a complete list because we've updated it. But if you give me 30 seconds, I want to just review my list to make sure that I have covered everything. I talked about the CNAs, the volunteer support, the medical equipment and supplies, the medication that's provided, bereavement counseling. I didn't talk about physical and occupational therapy. From time to time, we will have people in our care, like the man with the heart disease that needed some therapy. And so we do have therapists on board. It doesn't happen for all patients, and it actually depends on what that person's going through and their needs. We do have the music, speech, and speech therapists. Dietary counseling is given. Children's program, our caregiver support. We used to head up the caregiver coalition. But when the person, Tula Wooten, left, who was in charge of the community hospice, turned it over to Elder Source. Elder Source, that was one of the names I wanted to tell you all you could call for help. When we were talking about somebody coming in the house to help, a sitter. Elder Source. See, it came to me late, didn't it? Aging True is another organization, and they have offices all over that have seniors that volunteer for different areas. So Aging True and Elder Source are two wonderful resources to call for help. Okay? Family caregiver. I went down my list, and I've talked to you about all the services and programs. I talked to you about the locations, the 10 inpatient centers, our service areas, how services are paid. Did we go into detail on that? So let me just that's one of the main questions I get. Hospice care, we're not talking about palliative care, because remember my disclaimer with palliative care, there could be some fees. Your insurance may pay for it, but that's something that would have to be checked out. Hospice care is paid for by Medicare, 100% by Medicare. And I get that question all the time. And then private insurances does cover it, but I don't know. You would have to look at your private policy to see what's covered for hospice, or you can call your agent. What do they cover for hospice care? But Medicare covers. And that's why that recertification process is so important, because that's to keep them paying for the care. And then for the Medicaid, a lot of people have to apply for that to help as well. And social workers will help with all the paperwork for that. See, I don't look down at this much. I just want to make sure I'm not skipping anything. Can you all think of anything? Did you learn anything yet? Oh, good. I don't want to walk away and I forgot to tell you something. So, and it's all up here, So I want to just make sure that I went through everything that's important. And if you think of something, just raise your hand. Hospice care is for any life-ending or life-limiting sickness or disease. And in 1995, I was a caregiver for an aunt who had ovarian cancer. I didn't know what to do. Her neighbor said, call hospice. And I said, oh, there's an organization that helps people with cancer, because that's what I thought. But it's not. It's any life-ending, a life-limiting illness, and that could be dementia, heart disease, lung disease, liver disease, multiple sclerosis, Parkinson's disease, stroke, ALS, cancer, Alzheimer's disease. There may be others, but it's any life-limiting illness that qualifies for hospice care. Oh, I didn't cover this. So if your loved one's in our care, the nurses are going out, the CNAs are going out, and the caregiver needs a break, just a break. Maybe the caregiver needs to travel for family emergency or whatever. We will give up to 5 days respite care for that caregiver, meaning we will take care of that person's loved one for up to 5 days to let that caregiver take a break or go and do whatever it is they need to do. That's important. That's very important. We will take care of that patient. And let me tell you what we do. If we don't have a bed in one of the inpatient centers to put that person in for 5 days to take care of them 24/7, then we have nursing homes that we contract with that we will place that person in. We will take care of them. We just need to find a bed. So respite is really important, up to 5 days to give the caregiver a break or to travel or to do whatever they need to do. And that is arranged with the nurse or the social worker. Yes, ma'am.
That made me think of a question. So my husband's uncle was taking care of his wife, and then he had a situation where he got sick and he had to go into hospice before she did. But she couldn't stay at home by herself. So in that situation in Pennsylvania, the hospice center there allowed, even though she wasn't ready for hospice,
Yes.
they moved them both into hospice. They
That's
gave her
beautiful.
a place to stay until the family could figure out where she was going to go. So is that something that...
I have never heard that scenario. Everybody able to hear what she was asking? But you know what? I can get an answer, and I can get back with you. I have never had anyone, number one, ask that question or had to go and get the answer for a question like that. I think that's a beautiful thing, what they did.
Yeah, so they did. They put them in the same room
Yeah.
for 3 days, then they eventually found her,
A place, a spot.
where she...
I can find out. I will, and then get back with you, because that helps me to understand if I get that question again, but never gotten it. Good question. I don't usually get stumped. I usually have the answer. Any other questions? I'm looking through real quick to make sure that I'm covering everything for you all. Talked about the Veterans Partnership, the children's programs, Pete's Care, Peace of Mind. How do you request care? Anybody can request care. It doesn't have to be a doctor, and that was what I was saying earlier, because that's real important. I put these information visit cards, you have those back on that table, and it tells you what it's for. If you think your loved one, your friend, your relative might be ready, because you're not seeing any improvement, they seem like they're just, going down fast, you can say, I think they might need your help. You call this number for the information visit. It's no cost. Someone comes into the home to do an evaluation. If that person feels like, well, yeah, they might be ready, then that person is going to write it up, get the nurse, if it's not a nurse that come out, it may be an admissions nurse, but sometimes it can be counselors that come out. They're going to write it all up and get it back to the nurse in charge of that area, and then that nurse is going to get with the doctor, the hospice doctor, and that hospice doctor is going to get with the patient's doctor. So nothing else has to be done on the family side yet, because community hospice, if they think it's time, they're going to take the ball and roll with it and try to get approval and get everything set up. Okay? I talked about veterans programs. I'm giving you an opportunity to think of other questions for me. Care for children, the palliative care program. We talked briefly about honoring choices. We're going back to 5 wishes. Did you know that? Do you remember the 5 wishes?
Yeah, we just handed out the program we just did.
We used to do Honoring Choices Florida for 8 years, and now we still have some of the documents. You can still use those, that's not a problem, but we're going back to a document and a program called the 5 Wishes, and it does the exact same thing, just a different document to ask a few more questions. Okay. I asked the same thing last week, and they haven't gotten them in yet. Yeah.
I keep checking with Nassau County.
And they'll give you some. Yes. Okay. So that's the only thing that is changing there. And I love the 5 Wishes document. What? Uh-huh. Oh, okay. Yeah. So where is care provided? You know that now, right? Wherever you call home, care is provided. I talked about our 10 inpatient centers. If you visit, is there anyone here that has never been to visit anyone in any of our inpatient centers for community hospice? Most people have at least been to one, haven't you? Because you know we're in the hospitals now. Like St. Vincent's Southside, St. Vincent's Downtown, we have a section at both of those. Baptist, Nassau, there's one there. 8th Street in Duval County, that's the Morris Center, and it's across from UF Health. So we're trying to get into more hospitals, but we do have all of those covered now. Okie dokie. Can you think of anything else? I talked about what the volunteers do. I think that's it for all the programs. I don't like to add in a lot of fluff because I want you to remember the most important parts of the services provided, how you get services, how it's paid for, about what happens with the outpatient centers. Anywhere you call home, we come to you and bring everything to you that you need. We provide all of that. Did I miss anything? Yes.
There are qualifications for nursing home, and then there's your palliative care. And I'm not sure if they overlap or, if a person could avoid nursing home care by doing the palliative care.
Maybe for a while, but it depends on the individual and their health issue. So maybe for a while with someone helping to manage that medication, making sure they take their medication and the therapies or whatever that, I'm sorry, did everybody hear, I'm learning, did everybody hear her question? With palliative care, say it one more time. Replace, is that the word you were asking?
There's kind of a movement to avoid nursing homes.
Mm-hmm.
And so I was thinking that with your palliative care program, at some point, maybe a nursing home could be avoided.
So could,
Still need
yeah,
healthcare.
you do. Because we don't provide that home health care right now. They're looking into it. Livia Care, our other partner, is looking into doing that, but right now we don't. But the answer is yes, it could prevent that for a while, or maybe, indefinitely, depending on the illness and the severity of it. But the answer is yes. You still, like you said, would need a caregiver. Are you going to walk away with more information than you had? And now that you understand it's not just about death and dying, there's so much more available, would you call us if you needed us? Very good. Are there any final questions? Remember, all of this information is back there for you, and there's one main number when I leave. If you say, oh, I forgot to ask, call the main number and say, I have a question, and let them know what the question is. They'll get it to me or to one of my counterparts to get back with you. Or you can email me the question or whatever you needed to do. Yes. Okay, that'd be great. That'd be great. I think I've covered all the main information. Like I said, there's more, but I don't want to leave you with more if you don't need it. You know? Oh, you are welcome. Just have me come back anytime you need me. Yeah, especially for the caregiver support group. That might be good for them.
Most definitely. Thank you so
Oh,
much.
you're welcome. You're welcome. It's my pleasure.
We have a little token of appreciation for you.
Oh, look at the bag. Oh, thank you.
And we definitely will invite you to our caregivers group. In fact, the caregivers group has just decided to change the name a little bit.
Oh, okay.
Because so many of our caregivers, their receivers, have already passed on, and but they're still coming back because we all need support.
Support, yeah.
And you know, does the grief group do a presentation?
They don't, but remember, if they didn't have a loved one in our care, they can do the group
Attend a group.
Okay. Sessions.
So, yeah, we're going to change it to.
And I can get information for you about that.
I'll definitely be in
Okay.
touch. It'll be the we said life support, but it'll be caregivers and life support group.
Okay.
Because it's more than just
It is.
you just can't stop one day,
No.
you know, for caring for your loved one, and then
And if it's been recent, just give somebody one of those.
I
And,
will.
And if they have additional questions.
thank you, and thank you
welcome.
all for coming today.
Yeah, this is a good group. I didn't expect to see so many. Thank you. Thank you. Thank you.
I expected to see at least this many.
I'm going to give you that one.
Thank you,
too.
thank
You're
you.
welcome. I'm going to give you all of these, too. Just.
Can you hold on to that? Of course. There's something. Oh, okay.
Oh, okay.